Mr. President.
The senator from Louisiana.
Mr. President, I'm here to also comment, as Senator Cornyn was, on the state of play, if you will, and the repeal and replace of Obamacare. And I think sometimes the American people feel like collateral damage as Republicans and Democrats go back and forth as to what is the best policy. But I'm a physician, doctor, who worked in a public hospital for the uninsured for decades before I went into politics. And I guess from my perspective, the primary thing is not Republican versus Democrat, but that patient who's struggling to pay her bills, her premiums, the fellow who can't afford the medicine. What are we doing for them? And this is really brought home. There's a gentleman who went on my Facebook page, kind of, again, cutting through this kind of political noise, to say that this is Brian from Covington, Louisiana. My family plan is $1,700 a month, me, my wife, and 2 children. The ACA, the Affordable Care Act, Obamacare, if you will, has brought me to my knees. I hope we can get something done. The middle class is dwindling away. Can everyone just come together and figure this out? If that is not a plaintiff plea of someone who is drowning under the cost of premiums for insurance, which he knows that he has, and as a responsible father and husband he will work to pay for, nonetheless says that he is being crushed by this high premium. So the American people need relief. We have to lower those premiums. I've always said, though, that whatever we do must pass the Jimmy Kimmel test. That is to say that if Brian's wife or children or himself has a terrible illness, that there be adequate coverage to pay for the care that their family would need for that member of their family with that terrible disease. So it kind of brings us to where we are now. 2 aspects to what we're considering. By the way, when folks say that we're redoing 1/6 of the economy, that is not true. The Affordable Care Act, Obamacare again, attempted to address 1/6 of the economy that is health care. We are focused on the individual market, which is about 4% of those insured, and Medicaid. We're not touching Medicare. We're not touching the employer-sponsored insurance market. Now, so it's important to realize that this is not as comprehensive as the Affordable Care Act. It is something far more focused. Let's first talk about Medicaid, though. Under Medicaid, I am very concerned about what has been proposed for Medicaid, but also concerned about current law regarding Medicaid. Under the Medicaid expansion in the Affordable Care Act, states got 100% of all the cost of the patients enrolled for the first 4 to 5 years. As you might expect, states were quite generous in their payments for these patients as they contracted with Medicaid managed care companies to care for them. So much so that for those folks who are enrolled in Medicaid expansion, taxpayers are paying 50% more than taxpayers are paying for those in traditional Medicaid. And states enrolled roughly 20 million people in the Medicaid expansion program. The combination of enrolling so many people in the Medicaid expansion program and paying 50% more than for traditional Medicaid means that when states finally have to foot 10% of the bill, which they will by 2020, when states have to finally foot that 10% of the bill, they cannot afford that 10%. Unfortunately, under the Affordable Care Act, state taxpayers will not be able to pay what in California is $2.2 billion extra per year as the state's 10% share. Similarly, in Louisiana, my state, our taxpayers, me, my colleagues, my friends, my neighbors, would be on the hook for $310 million per year. Our state's having a budget crisis because we can't afford $300 million. Now it's a $310 million recurring bill every year. So one thing that is not said is that Medicaid expansion in its current format is not sustainable. We have to do something, again, to preserve benefit for that patient. We have to take care of that patient, but we have to make it sustainable both for the federal taxpayer and the state taxpayer. By the way, whoever's watching this is both a federal and state taxpayer. You're getting caught both ways. Now, let me speak a little bit about the process. If we want to speak about Medicaid, we've just laid it out. Let's speak a little bit about the process, because much has been said about it. I don't particularly care for how the process has transpired, but I certainly understand Leader McConnell's concerns that Democrats would not collaborate. And I find that a sorry state of affairs. What do I mean by that? Susan Collins and I and 4 other Republican senators put forward a bill that would allow Democratic states to continue in the status quo, to get the money that they would have ordinarily received under the Affordable Care Act, and to continue a system much as they desire to have for the whole nation. The minority leader, Chuck Schumer, condemned our bill before we filed it, meaning before he had had a chance to read it. Without reading our bill, he condemned it, even though his state, New York, would have been allowed to continue in the program that they are currently in and receive the dollars to support that program. Condemned the bill before he read it, even though it would have allowed his state to continue in the status quo. Similarly, we approached senators, many other senators in that same regard, 10 at least on my part, and none would help us with our bill, even though their state could have continued in its current status quo, receiving the income it currently receives. So that tells me that even a good faith effort to reach across the aisle was not going to get cooperation. That's too bad. And that's where I think there is kind of a political back and forth in which the patient, the American like Brian, struggling to support his and cover his family, get lost in the crossfire. A goodwill bill designed for states to do that which they wish to do would not even be considered by the other side. I will say, I've always pointed out, that if even 2 Democrats had walked into Mitch McConnell's office and said, we will work with you to pass a bill, they could have gotten far many more things for their state than saying, no, we've not been invited to the party, so therefore we will not participate. And I say that as an observation, not as a criticism, but also as an explanation to the American people how we've ended up in this position. Now, as to the bill that will be before us, I've not seen the written language. I reserve judgment until I've seen that. But I will say that there are some things that I like. If our desire, again, is to take that patient, the American citizen, and make sure his needs or her needs are met, a family such as Brian describes here that cannot afford their current premiums, there are things in this bill which will lower those premiums. There is the so-called cost-sharing reduction payments for the next couple years that would continue that would provide certainty to the insurance companies so that when they market insurance on the individual market, there would be certainty. They would be able to know those dollars are coming from the federal taxpayer to support folks for the next couple of years, and they could lower their premiums accordingly. There'll be a so-called state stability fund that going forward states could use to create what was called the invisible high-risk pool, a reinsurance program, if you will, so that if you're a patient on dialysis, a patient with cancer, very expensive to care for, you continue to get the care you require, but everyone else in that insurance market has their premiums lowered because there is a little bit of help for those folks with those higher cost conditions. By that, we lower premiums. President Trump, when he was running for president, said he wanted to continue coverage, care for those with pre-existing conditions, eliminate the Obamacare mandates, and lower premiums. And what I've seen, or at least heard, we are on the path to fulfilling President Trump's pledge. Now, again, reserving judgment till I've seen written language, I will say that what I've seen so far keeps the patient as the focus, would address someone like Brian, the needs of his family, the needs of their pocketbook, as well as their health, and build a basis so that going forward, states would have the ability to innovate to find a system that works best for them. Mr. President, on behalf of those patients, I hope that we as a Senate, whatever our party, are successful, and I hope going forward, we as a Senate, no matter what our party, put the patient as the focal point, hoping that our combined efforts, again, no matter what our party, will address her needs or his needs, both financially and particularly for their health. Mr. President, I yield back. And Mr. President, I note the absence of a quorum.
The clerk will call the roll.